For this lab, we'll be starting on the abdomen of the calf specimen, and we'll be starting with the abdominal wall and the different layers of muscle, and then we'll be palpating inside the abdomen itself to feel the abdominal contents and identify structures, and then you'll be actually taking out the abdominal contents and studying them that way as well. So to start with, we're going to take a look at the muscles of the abdominal wall in this area. So here we're on the left side of the calf, and we're taking a look at this abdominal wall area. But before we get into the layers of the abdominal wall, I would just want to point out this subiliac lymph node. So in the calf, this is quite large, and hopefully you'll be able to see it. You may or may not see it on the left side, depending on whether or not you removed it with your left hind limb when that was done. But it is quite large, and it usually is in a bunch of fat and fascia right here, right in front of where your leg would have been. So subiliac lymph node right there. Then we will look at the external abdominal oblique muscle, which is the most extensive muscle here. So it goes all the way down, and it's attaching along your costal arch on the ribs. And you'll be detaching that and reflecting it distally all the way to the ventral midline so that we can see the rectus abdominis muscle. So for the dorsal cut, you're cutting it right along the lumbar area here, and then you're going to cut it away from the ribs along the costal arch, and then cut it kind of straight down ventrally, and then we will reflect that all the way down. And here you will have to work around your previous surgery site. So these calves were repurposed from a surgery lab, and so most of them have this hole here in the side that would be going into the rumen. So you have to kind of work around that as you do this. But you'll reflect your external abdominal oblique and take it all the way down toward the midline. And then once you reach the edge of the rectus abdominis muscle right here, you can stop reflecting it. And on the left side, you have the option of actually removing it so you can see more of this rectus abdominis muscle. So rectus abdominis is the one running ventrally along the whole belly here. And then external abdominal oblique is this one. Here you have the internal abdominal oblique as the next layer, right here. And something to note in the bovine is that the paralumbar fossa is kind of in this space right here. You can't tell in this animal because it's embalmed. But that paralumbar fossa would be right here, about where my hand is. And it's due to the thinness of this muscle, of the internal abdominal oblique muscle in this area. So the internal abdominal oblique, you'll make a similar cut along the lumbar area here and along the caudal edge of the ribs, but only down to about the end of the last rib there. And you're going to reflect this distally. So taking that down so you can get a hand inside, so make sure it's at least large enough for you to get your hand in. Then the next layer, which is quite thin and sometimes a little difficult to see in the calf, but it's the transversus abdominis muscle, and here is mainly aponeurosis at this point. But here you have some muscle fibers you can see of the transversus abdominis. So again, you're going to make a cut right here along the lumbar area, caudal to the ribs, and then reflect it distally. So just like that, and then you'll be inside the abdomen itself, and you'll put on a palpation glove and feel some of the structures in here. Mostly what you're seeing right now is the rumen. So you would have rumen on this side, or you can also call it the ruminal-reticulum. So that would be what you're mainly seeing on the left side. You can also cut the diaphragm, and we can make a window to see more structures. So you can kind of cut along the ribs and then flap that forward, and you can see the spleen. So the spleen would be right there. So you'll be able to feel many more structures when you palpate inside, but those are just a couple things you can see on the left side here. And now we'll go ahead and take a look at the right side of the calf. So here we're looking at the right side of the calf. And before we start our abdominal wall dissection, I just want to point out the subiliac lymph node. So this one, hopefully you will have for sure on your specimen on the right side since you haven't removed your right limb. So it's just cranial to the thigh muscles here. And you'll look in this fat and fascia for this large subiliac lymph node. So try and find that. And then you can move on to the abdominal wall dissection. So here we have the external abdominal oblique, the very extensive abdominal muscle. And you're going to cut that away from the lumbar region and then along the costal arch, along the ribs, until you reach the rectus abdominis muscle. So here you can see the rectus abdominis right there, running along the ventral midline of the belly. Then the next layer you are looking for is the internal abdominal oblique. So this is internal abdominal oblique. And again, the area of that paralumbar fossa would be right here, where my hand is. The internal abdominal oblique, you'll want to make a similar cut along the lumbar region here, and then along the ribs, and reflect that distally as well. So you're just taking that down to about the level of the last rib, or just a little bit further, so that you can get your hand inside. So then the last layer we'll look at here is transversus abdominis. So here's the transversus abdominis muscle. And you'll make a similar cut along the lumbar area here and along the caudal edge of the ribs, and reflect that distally as well. So now you'll be looking inside from the right side, and you'll be able to see some of the other structures that are on your terms list. And you'll want to put on your palpation glove and feel inside. You can also cut a hole in the diaphragm if you want to create a window. And so you can pull that cranially here, pull it forward, and you'll be seeing that will mainly show you the liver on this side of the calf. So you'll be able to see that if you pull the diaphragm up that way. You should also be able to see kidneys, which I can see a kidney right here. I don't think you can probably see it on the video, but I can see it. It's going to be right there. So you want to palpate, put on your palpation gloves, and feel those structures inside the calf. Then you will be creating an incision that connects both sides of your abdominal walls. So you're going to continue this cut all the way down and around, and you're going to connect both sides, left and right, on the midline. So that way your whole abdominal wall has been cut, and it will drop the abdomen contents onto a table. So make sure you have a table underneath the animal, and then you can go ahead and connect those incisions and then drop the GI tract onto the table. So after that, you'll see the dorsal attachments and where those attachment points are inside the animal. And then some of you will be removing the contents entirely to study them on the table. Here on the right side of the calf, we'll look at those structures that you palpated. And in this view, you can see the liver. So the liver will be here, and you can actually reflect your diaphragmatic window that you made and see almost the whole liver. So the whole liver is pushed over to the right side due to the volume of that ruminal reticulum on the other side, taking up that space. So the liver basically gets pushed over to the right side. So you're seeing all the liver here on the right. Then we also have the right kidney, again, is kind of encased in fat. If you can see it up here dorsally, you can just see a tiny little edge of it. So that's the right kidney up there. Then we have the caudal flexure, or caudal loop of the duodenum right here that you can see. This darker part. This part here is the greater omentum, so that will be covering up the abomasum and omasum that would be down here, and hopefully you could palpate those. But the greater omentum will be covering all of these structures in this area. And I just want to point out that you have a superficial layer, so that's here, and that's what I've cut through. So you can make a window into it, and then see that there's also another layer underneath. So this is the deep layer of the omentum here. So superficial layer and deep layer underneath. Then we can also see those small intestines here. So we've got jejunum there. And then your descending small colon, you can just see a little bit here. And that's about it for the calf. The only other thing I want to mention here is that you'll be removing, some of you will be removing the abdominal contents, and some of you will be leaving them in place. But for those of you removing them, it's very similar to what was done in the equine, in the pony. So we'll want to remove the abdominal contents all together. And so you're going to connect your diaphragmatic windows, and you're going to cut the esophagus, the caudal vena cava, and the aorta, all cranial to the diaphragm. So that all of those structures, you have a little piece of them that goes with the diaphragm that then comes out with the abdominal viscera. You also want to make sure and peel your kidneys away from the dorsal body wall so that those stay with the viscera. And then you're going to tie off your descending small colon back here and make those 2 ties with string and then cut in between the 2 strings so that we're not contaminating the whole specimen. So now that we have cut through our abdominal wall and we've put a table underneath the calf, we've allowed the viscera to come down and rest on the table. So you've connected those 2 sides of your abdominal wall cuts. So I have part of my wall here that's been reflected, and you actually just connected that from the left side and the right side and connected them on the midline. And if needed, you can make a cranial cut as well, right up the midline, up to the rib cage so that everything kind of just drops onto the table. In the calf, it may not drop down as much as in the pony, but you have a few things that I want to show from the left side here that you were palpating from the left side. And hopefully you can see the kidney. It is pretty much encapsulated in fat, but that will be right here. And then you have your rumen right here. So that's taking up most of the view in the left side here is the rumen. If you reflect your diaphragmatic window, you can also see the spleen. So here, if we lift that up, you can see the spleen on the left side here. Then we also have the small intestines. So you have jejunum that will be here. And then the only other thing from the left side before we move on to the right side that I want to show is the ductus deferens and the bladder. And that's going to be way back in this recess here. So the pelvic inlet is inside and we need to take a look in there. So now we just want to take a look inside here and see the ductus deferens here in the male. So ductus deferens will be here in that vaginal ring area. So the ductus deferens, and then further back in the pelvic inlet nearly is the and now we'll go ahead and take a look at the structures on the right side.